ascending cholangitis. Let's talk about that for a second. This is one of the complications for cholangitis. I'm going to tell you a little story. Let's go back to our picture here. Inside your duodenum is a lot of poop, right? Not really the nicest thing. They look nice when you're eating them though, until they get digested. And inside there's a lot of bacteria. So the definition of ascending cholangitis is what? Something is going up, right? Through the steps, right? Affecting the colon, again, biliary tree, right? Chole, biliary, gallbladder. Itis again, inflammation. In this case, what's causing the inflammation is an infection. So an infectious process creeping up into this green line, which is the common bile duct, is called ascending cholangitis. What do you think is causing it? Bacterial overgrowth. Now let's talk about the guys that actually playing a role in this. And I love this story. So one day, E. coli, Klebsiella, Ella, Proteus, Pseudomonas, enterococci, they were just hanging out. Couple buddies, right? They were just hanging out. Right? So I call them the sick PP pneumonic. Serratia, Enterococcus, E. coli, Klebsiella, Proteus, and Pseudomonas. These are what? Gram-negative bacteria. They were just hanging out in your colon, right? And all of a sudden they're creeping up, and there's a little hole. They're like, man, yo, E. coli, you want to go check that place out? They're like, yeah, I'll go check what's up in there, man. E. coli climbs through the little hole, goes up. Is this something that's like, fellas, I can't really see, but y'all want to come up here and see stuff? His buddies come with him. They ascended. They climbed the stairs. They all climbed the stairs. Now they end up into what? They get into the biliary tree through this beautiful hole. And now they're having sex. Mating, bacterial overgrowth. Now you've got an infection. So now we know the cause. Let's talk about the history. What is the patient going to present with? We actually have to erase this and talk about something very important. Call the Charcot's Triad. Fever, right upper quadrant pain, jaundice. Now, this doesn't really require a lot of memorization, because I told you we talked about cholelithiasis. And one of the complications of cholelithiasis, if the stone gets stuck there long enough, bacteria can come up there, they're having sex, they're growing. So now, I'm not surprised with the right upper quadrant pain, because that's where the stone coming from, right? I'm not surprised with the jaundice, because we talked about what's causing the jaundice. The only thing I'm not freaking out over, is the fever. Because fever, right upper quadrant pain, and jaundice, it's called the classic triad. Usually 50 to 70% of your patients, this is an emergency. I do not want my patient to be jaundice, right upper quadrant pain, and a fever. And that's bad. So, what do we want to do? We want to order labs. When we order labs, another thing before actually we order labs, Charcot's Triad is this 3. We can expand it to Reynolds Triad. And I can tell you, if you think Charcot's is bad, Reynolds is even worse. And I'm going to explain exactly why Reynolds is bad. So now the bacteria having sex and doing their little thing, right? You think that's cool? No, it's not. Because when this bacteria gets into the bloodstream, now you've got a problem. You get into SIRS, Systemic Inflammatory Response Syndrome, right? You become tachycardic, heart rate greater than 90, right? You get a fever. Now all of a sudden, your white count goes up about more than 12,000. It's not the end of the world. You think that's bad enough? You become tachypnic. You start to hyperventilate. That is really bad. You get warm skin. You go into sepsis. Eventually bacteria, because we're going to actually talk about sepsis and septic shock. You go into septic shock, right? Systemic vasodilatation. All of a sudden you get altered mental status. Now that's called a Raynaud's pentad, which is the extreme of a Charcot triad. Because remember, the fever is because the bacteria are coming in and the neutrophils are trying to infiltrate, and now once the bacteria's context is broken apart, that's what starts to cause the SIRS. That I talk about, systemic inflammatory response syndrome, and eventually people develop altered mental status and they go, right? You don't want that to happen. So, what do you want to do? When we order labs, you're going to see elevated bilirubin, right? Conjugated bilirubin is going to be high. Just as in cholelithiasis. LFTs, you check what? You check ALP, alkaline phosphatase, it's going to be elevated. GGT is going to be elevated. Do you think you're going to have a white count? Yeah, that's what I was trying to tell you before. The white count, the white count. Why do we order CBC? Because now we see it got a shift, which means neutrophils are coming in. Right? Lab-wise, LFTs, we get alkaline phosphatase, and we get a GGT. Conjugated bili, and if you don't know why we're saying it's conjugated, because the liver already processed it. The UDP, glucuronidase transfers, already added glucuronidase, also conjugated your bilirubin, so all of a sudden it becomes water soluble and it's able to come out into the gallbladder. So it's already conjugated. It's not an intrahepatic problem. This is more coming outside here, right? So the conjugated bili will be high. We got a white count. We see WBC is going to be elevated, maybe with increased left shift. A lot of neutrophils. We get a lot of neutrophils. That is badness. Okay? So what do we want to do? How do we treat this patient? You can do how we want to also use. The next thing you want to do is get an ultrasound. You ultrasound the belly. The belly is going to also show you the cholelithiasis. ERCP is what we have to do. We have to drain this, right? But before we do that, we still got to order more labs. I want to get a blood culture. Why do I want to get blood culture? I just told you E. coli and his friends are mating. So I want to be able to see them and know exactly what antibiotic I got to give. I'm worried because this guy might go into sepsis and go into shock soon, so we give them IV fluids. Remember, this is an infection. What do we use to treat infection? We give them antibiotics. Now, the most important thing is to do an endoscopic retrograde pancreatic cholangiography, ERCP. What is the point of that? Because the ERCP, like I told you, we're going to put a scope down there, we go all the way into the sphincter of OD, and now we can suck the stone and also suck out all those little dirty stuff. Okay? That is extremely important. We decompress this common bile duct because it's probably already distended. We use a catheter and we do a sphincterotomy. Okay? Also, sometimes they put a T-tube in there. So for drainage, for especially a lot of people that don't respond to antibiotics. So, the problem is, this is a very serious emergency. Okay? One of the biggest complications of cholelithiasis. Keep this in mind and don't forget. Thank you. Hey, thank you so much for watching the video. I hope you learned a lot. Are you studying for the USMLE Step 1 or Step 2? Are you studying for the NCLEX or you're currently in nursing school as a nursing student? Are you a PA student currently in school or studying for your PANCE exam? Or are you a nurse practitioner student or trying to take your NP board exam? Listen, I've got super awesome content for you. If you truly love this video and it simplified your learning process, I want you to check out my website below. I've listed all the list of exams, whether you're studying for any of this board exam, and all I want you to do is click on the link right now below so that you can take you directly to my website. For USMLE, just go to smashusmle.com. For NCLEX, go to crushnclex.com. And if you're studying for the PANCE exam, the nurse practitioner exam, or you're studying for your internal medicine board exam, just click below and it'll take you directly to ftplectures.com. Listen, I can't wait to help you. If you need to get in touch with me, just get to my website, you're able to reach me directly, and we can work together one-on-one. Listen, you're super awesome, and my goal here is to help your dream come true. If you want to be a doctor, want to be a nurse practitioner, a registered nurse, or physician assistant, I'm here to help you get to that next level. With your medical knowledge, let's save the world together. I love you guys. You guys are super awesome, and do not forget to click on the link below to be able to get to my website. Also, don't forget to subscribe to my channel. You guys have a great day. Let's go.